the Pause It podcast. I'm Dr. Sam, and with me is Dr. Robert. How are you?
Good, Dr. Sam. How are you doing today?
I'm good. We're doing some good OG podcast, just me and you.
I know it's always a nice time to catch up. Some good therapy for the both of us. It's been a
Yeah,
crazy week, so I'm
exactly.
actually looking forward to this.
I feel like lately it's been a lot of like looking at what's been going on at work and then just like giving us some time to cathartically like add it to the podcast, like put it out
In
into the world. You know what I mean?
a politically correct way, 'cause
Yeah, exactly. Well, just in an overly healthy way for everybody, right?
exactly, because sometimes it's in the moment my filter is off, so it's good that I'm just on the podcast.
Well, this is a good way to do it. This is a healthy way to do it. And I have been noticing a lot of pregnant animals around me lately, and so that's been the sort of inspiration for today.
Tis the season for
Yes, exactly.
pregnant animals, so it's a pain, but I'm really excited to talk about it. So
Specifically, pregnant kitties actually have been the thing that I've seen. So, one of my technicians just had a cat that she rescued that was pregnant, and then just had kittens. And then there was it's a really funny story actually. Somebody who I know, like totally outside work, found a cat in her backyard and happened to bring it to my clinic to get just like microchipped. And then the girls all started helping and they were like, "Hey, do you know this person?" And I was like, "Yeah, I know this." Like it was just one of those weird things, and like I don't even think she realized that that's where you know what I mean? Like it was one of those like totally weird things, and I'm like, "Hey, this cat you thought was a male is a pregnant female."
guys,
Surprise. So yeah, so it's funny how that all works out, but turns out to be a very sweet kitty, and yes, is pregnant. So yeah,
hey,
sort of is 'tis the season for lots of new animals to be joining us, and so this is the what to expect when you're expecting Pause It podcast, animal edition. Um, and I think going back to our roots, like we had once talked about emergencies that have to do with giving birth and stuff like that. So this is a little bit different. This is more of like the stuff that you should do maybe in preparation and also what to do when you find yourself in the situation of having an animal that is pregnant. So yeah, that's what
I'm
we're talking
excited
about.
for it. Yeah, because I think it's just something that it's it's not like you're necessarily having a human baby, but you should plan a little bit for it because it will either make things a lot less expensive for you later on,
Mhm.
if you don't do some of these things. So it's kind of nice to like plan ahead and just like you make it the nursery and you get supplies and you try and do ultrasound to see the health of the baby. You're gonna do similar things for cats and dogs. Not as many cats as much. I guess I not this maybe being a bad vet. Maybe don't need to do it as much for cats because I can't think of the last time I saw a cat in my ER that's had a problem giving birth.
I have had one cat dystocia where
Okay.
I had to do a C-section in a cat. It was
Oh,
sort of an odd situation. I don't think I'll ever see it again. Like I think it's so rare for queens to have a hard time giving birth. Cats seem to just really figure it out. But um but yeah, no, this one was a weird situation. It was a cat that was pregnant and only had two kittens. One of the
okay.
kittens died in utero. So I
Uh,
sort of warned the owner. I was like, I don't know if this other one's gonna survive, you know. But turns out cats being cats, they're amazing. And this little tiny kitten made its way, and I think actually probably got bigger because there was only just the one, you know.
yeah, okay.
So when it came time for birth, mom just was not advancing. And
Yeah.
so yeah, we had to go in and go ahead and we spayed her and we got the kitten and kitten survived and did great. But it is a rare story, you're right. I mean, we just don't see it as much as we do with dogs. I think partly because of the breeds, right? Like there are certain breeds where we just see more problems giving birth than others.
Absolutely. I think we haven't changed cats' genetic makeup that much in terms of like they're still around the same size.
Yeah.
They almost besides changing their face a little bit or change their length of their hair, things haven't changed that much with a cat in general. But like if you look from like a Chihuahua to a Great Dane,
Yeah.
we've done a lot with their anatomy that's changed since then. So that's why I think they have more complications in general. But that's why I think most of the podcasts are probably more aimed towards dogs. you're a great parent if you do it for cats too, but it may not be as necessary.
Well,
If you're
and
trying
I
to,
think if you want to know, like, how many kittens you might get, or like what, what's the steps, you know what I mean? Like, what do we do to take care of those guys? It's not that different if you want to take those steps for a cat. It's really not. It's like quite
exactly.
similar actually.
And
Um,
maintain nutrition too. Like nutrition's a big part of it in both cats
mm,
and dogs. Good
yeah,
nutrition. So that's something you talk to your vet about because their nutrition requirements change. So we'll get into a few of those things. But
yeah, for sure. And I think the other thing too with dogs is like with all these hybrid, like, I don't, doodly kinds of things, like
yeah,
depending on which doodle is you know what I mean? Like which one is the big one and
predominant.
which one's the small one. You know what I mean? Like sometimes I think that also plays into it a little bit
Uh,
too.
which one's the big one? Which was the small? That's fair.
Usually you want mom to be the big one if you have a
Yeah,
choice.
I would wholeheartedly agree. Yes, make one the big one, so life is easier for everyone.
And truthfully, like, I would say if you are going to, like, purposely breed a dog, um, again, more so than a cat because they just tend to have more of a hard time, like, work with a vet that does a lot of that. I mean, I'll be honest with you, I have to look it up almost every time, not because I don't know it just sort of, like, generally, but because if I'm really gonna be guiding somebody medically, I really wanna make sure that I'm up to date on my recommendations, and even just in the time that I've been involved in veterinary medicine, some things have changed, like the idea of when to vaccinate or if to vaccinate, I believe has changed in our time of being in veterinary medicine. Like
Yeah.
now I was just looking it up like in preparation for this podcast. We can sort of get into it a little bit. Like what do you do ahead of time? So like I think there's two different conversations, like the planned pregnancy and the accidental pregnancy, right? So for those people that are planning, I mean, go to a doctor that does some theriogenology, like go to a doctor that like actually knows what to do, does it all the time, and is comfortable with it because there are more specialized things you can do, like, making sure that you know when they're about to ovulate, or, when you know that they're going into heat. And then also, making sure that you've done all the like routine stuff. So the recommendation is actually that you get them vaccinated just before you breed them so that they are at the height of their immunity so they
Mhm.
can pass it along, but that you're not actually having to vaccinate while they're pregnant. And I do remember, and I mean, this is going back almost, gosh, it's like 15, maybe more years ago, where I do think like they were vaccinating pregnant dogs, but now that's not the recommendation.
And so I didn't know that, and that's why I think it's just as important to just like you'd see like a gynecologist if you're having a baby, you
Hmm.
should do that for dogs and cats, especially if it's planned. And I think the PSA is adopt when you can. We don't need
Right.
more puppies and cats in the world, but if you're going to have more, do it the right way if you can, because
Mhm.
it goes a long way towards improve their health and like stuff like this. Like I said, I didn't know this just because it's something that I don't deal
Well,
with
you
on a
don't
day.
deal with, and, like, by the time they see you, they're having a problem with pregnancy, they're not, like, trying to get
Exactly.
through it. And with cats, it's never been recommended to vaccinate them because the, feline distemper vaccine can harm fetuses, so you don't that is, like, an absolute no, that's been a no since I remember even being around it, so I don't ever remember that being something. And now, obviously, I'm sure there are times where you find a cat, they get vaccinated, then you figure out they were pregnant because cats are really good at hiding stuff. So sometimes that happens, and there's nothing you can do about it at that point. I will
Yeah.
also say, and this may be controversial, but like a lot of veterinarians, and I'm not going to weigh in on what the opinion is on this, but just like will spay a pregnant cat.
Mhm.
And I think that is overwhelmingly true in the shelter situation
Yeah.
because there's just so many cats, and their consideration, their concern is really more about population control versus individual health of the pet. So I mean, I think I'll just like make a nod to that. I don't think I don't hear that as often with dogs, but I do hear that a lot more with cats.
That's funny. Actually, I think I agree. I think most time it's wow. That's yeah. Actually, that's a really good point. But I never thought of it that way. But yeah, most times I know veterinarians that spayed cat or dog. It's a cat for that reason, not necessarily a dog.
Right.
Um, I think maybe because it sounds horrible, but it's probably because people try and charge the puppies. Kittens, and it's horrible. They're a
You're
dime a
giving
dozen.
it. You're just giving them away. You're like, find a home if we can.
Yeah, like
And I
you don't
think that that's
charge.
what it is. I think that it's harder for like your average domestic short hair cat or domestic long hair, whatever, like just like your run of the mill cat to
Mm,
find a home. And there's just so many in the shelter. So that I think is where a little bit of that comes in.
yeah,
And you're right, yeah, with puppies, it just seems to be a little different. Maybe it's also just the sheer amount of puppies. But again, there's so many unwanted dogs too. So I don't know exactly what drives that. I'm not even going to pretend to know that,
yeah.
nor really weigh in on where I stand on it. I just that's what you're going to find, out there. But really what we're talking about is like individual health at this point in time, like what to do when you find yourself with a pregnant dog or cat that you plan to help get through to the point where they're actually like going to whelp these puppies or have their queening. And they
That sounds so nice, you know? Have their queening.
queening. So, um, and so, I think it's important to know like how long they're pregnant for. So it's pretty much the same for both of them. Somewhere in that like 65-ish range.
Yeah,
In I think where you have a harder time is that with dogs, generally people sort of kind of know when they tied, like they have some idea of like when that happened. So if you know when that happened, then you can kind of make a good guess.
yeah.
If you don't really know, I've heard the like gap be somewhere between like 58 to 68 days. So that's about a 10-day gap there. That's pretty big. Cats,
Mm.
it's even bigger. It's like 52 to 74. So
Really?
that's pretty long, but 65 on average, for both
Okay.
cats and dogs.
Interesting. Yeah, because I remember it being around 60, like 64, 65. So
Yeah.
definitely I just don't have these conversations anymore. So I'm glad we're doing this because it's something that I just see them when they're like, because most of the time it's like that, and I'll say I think we both agree a majority of cases that we probably see are either unplanned or just not prepared for.
Yeah.
So they're like, they're pregnant, and like we're just gonna deal with it.
Mhm.
So I think knowing the timeline, it's helpful for probably I think breeders probably are a little more aware of it just because they're
Well,
actively trying.
breeders know. I mean, breeders know, they know all the like I mean, there's hormonal things that you can do, like tests and stuff like that. Um, if you really want to get into it, not only just to know like I guess I mean usually they know when they're receptive just based on the timing
Yeah.
of their estrus and stuff like that. But I think there's also tests you can do hormonally for pregnancy.
Mhm.
I've usually found that to just not be needed because usually if you kind of know roughly when you think that they were pregnant, um, really, I mean, you can ultrasound them and you don't even have to necessarily expose them to the radiation until you know they're roughly. So you can't even see the babies on like x-rays until about 45 days.
Uh,
And in cats it's really not recommended to like x-ray them until at least 40 days. And dogs, I mean, there's really no point until they're mineralized, and that takes about 45 days into the
yeah.
pregnancy. So usually at my clinic, I can tell you what we do, when people think, "Oh, I think my dog is pregnant." Then we'll usually say, "Okay, well, we can confirm pregnancy by ultrasound at about 25 days or so." Now you can
Yeah.
see the vesicles a little earlier than that, so like you can start to see the formation of things around like it's like 18 to 20 days, but if you want to actually find a heartbeat to see if it's a viable pregnancy, that's about
Mhm.
25 days on ultrasound. So we'll usually sort of say, okay, well, at around 30 days, where you think 30 days is, right? Because there's always a give or take of 5 days.
Yeah.
Then, we'll do the ultrasound, we'll confirm pregnancy. And then based on that, if we see a heartbeat and all that stuff, then at about 20 days after that, so that would get to us about that 25-day mark. That's when we'll do the radiographs. And usually we try to push it to 50 if we can, 50, 52 days, just
Oh,
because
nice.
that way that leeway is there. And so you can kind of use the same guidelines for cats. Cats, you can actually tell the heartbeat a little earlier. It's like 15 days is the earliest, which is
Wow.
actually pretty early on in pregnancy.
Yeah, that's huge. I mean, because that gives you a lot more information because then you have to start making adaptations for the mother, right? You're trying to make sure they're eating enough. That's a big thing. They have more energy requirements now than they did when they were just a little old, cat or dog. So they're supporting a lot more. So like feeding them more. I think was it was it 2 or 1.5 times their normal RER?
Twice,
Like,
yeah, twice as much. At
yeah,
least for dogs, I know, like, by somewhere around halfway through the pregnancy, and so I would just assume kind of, like, assume the same thing for cats, and truthfully, I'm like, at that point, you just eat, you know what I mean? It's fine, but, you wanna get them on, like, probably about twice as much, interestingly, because of this little kitten that just came into our our world, I went out to the store just to see what was out there, like, I was just gonna go buy kitten food for the pregnant mom to eat,
yeah.
but actually there are, Royal Canin actually has a food that is, like, meant for pregnant moms and kittens, which I thought was cool. So
Oh,
I
really?
got that one.
Oh, nice. That's nice
Yeah,
to
I mean,
hear.
it's Royal Canin, so I felt, like, pretty comfortable being like, "Okay, well, I know it's, like, researched food, and I feel, like, comfortable with this." So we gave this cat, I mean, man, she like, you would have thought nobody ever fed her in her life. Like, I've never seen such a food motivated cat ever, but, she was a stray, she was outside, and nobody knew she was pregnant, so they were giving her food, trying to get her to, help or
Yeah.
whatever, and, so she would eat, but, like, and she was obviously still hunting out there too because she was in great condition, but yeah, she she came in and she was ravenous, she was pretty hungry.
So this is so much better, food's right for me, so
Yeah, it was actually really fun because the day that she was brought in, it was a pretty busy Friday. So like I didn't even know what was happening until the end of the day. I saw this cat and the other doctor I worked with was like, "Oh yeah, it's not male, it's a pregnant female." And I was like, "Whoa, weird," and so they were trying to figure out what to do with her, you know what I mean? And it's a
yeah.
Friday night, so it's like nobody knows. So I was like, "Okay, well, let's just keep her at the clinic and I'll just pop in and take care of her over the weekend because my kids will be like jazzed that they get to take care of a cat for the weekend." So I actually brought the kids in and they were playing with her. She's like super sweet, just like a little lovey-dovey cat. And especially like they were feeding her and she was just like, "I love you guys so much. You're giving me food." But I mean, like she would like let them turn her upside down and like, I mean, just like a cat that's like just really sweet. And so I took them into the ultrasound room and I ultrasounded her and I showed them the kittens and they
Aw, that's
they
cool.
just got like such a kick out of it too. They just like loved it completely. They were like, "This is great."
And a side note, have you done any of those presentations for your kids' schools yet? Been like, "This is how to be a vet," or anything like that? Because I feel like you're, like, the greatest person to do that, when you're like that.
It's actually really funny, so not yet. I'm expecting it to come soon. I have gone to both Nora's classes and Charlotte's class to, bring their guinea pigs when they've been the star student for the week. And usually I will bring the radiographs that I took of the guinea pigs and let the kids see the radiographs so they can see like what the insides of the guinea pig looks like. And then we just usually talk about like what they eat and how to take care of them and stuff like that. And one of the other classrooms has a guinea pig, so they all know Mr. Stink. And so like they like I like explain how he's different than them and you know what I mean, that they live together and they're, you know what I mean, and they're just like they're girls, he's a boy, you know what I mean? Like but it's fun, like we've talked about it. But I actually have they do these things where parents can come and like teach something and so my both my girls want me to do what they're called afternoon adventures. And so both my girls want me to do a veterinary afternoon adventure. So I was like, "Oh, maybe I'll do something where they, can do surgery on stuffed animals like we did in vet school." Remember
Oh, cool.
at
I remember
at vet a visit we used to do
that
that. So
visit. Oh my
so we'll
goodness.
see. Yeah, I know. So I they would get a kick out of that though. So I might do something like that one day if we can get it planned.
That sounds great. I was like, as you're talking about this, I'm like, Sam would be really good at this. I feel this is her, like, thing, so
I love kids and like it's so fun when they get really well, because you just did that thing not that long ago with the Girl Scouts,
yeah, that was
and
fun too.
they get like genuinely so excited.
Mhm.
And it's even if it doesn't really translate to them, being veterinarians or doctors or anything like that, like getting kids excited about science and understanding that like to be able to do these types of things requires like that you pay attention in school and that you learn math and you learn science and like it's like I'm a nerd at heart, so like I love to like get the nerd spirit going in little kids and like it's so fun to learn and this is why because you get to do cool things like ultrasound pregnant kittens.
That's cool. That's great. Yeah, I could definitely see it. We had a good time with the Girl Scout thing, but I think it's just a nice thing to be able to share what we know and see people get excited about it. It's like
Yeah.
it kind of brings us back to why we got into the field in the
Yeah,
first
yeah. Well,
place.
because we do it's easy to get bogged down with, like, when you can choose, right, to like get bogged down in like the things that don't go well or the people that aren't happy or whatever, or we can sort of celebrate like, hey, the wins, the times we, help an animal and like look at this, like this poor little creature was like starving in the wilderness and now she's going to be born in very well fed, very comfortable situation. So,
Yep.
you know. So
You
yeah,
traded
she's
up.
really cute. Yes, my children named her Sunny, so we'll see if that ends up staying
No,
that way or not. I
you
don't know. What?
you keeping her?
No, 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 no.
Oh, I was like,
No, I don't
yeah,
think so. She is a hunter, and then when I tell you, like,
a guinea pig.
she yeah, so the guinea pigs, I don't know. It makes me very nervous. I feel like our first responsibility is to the animals we already have. And it always is one of my pet peeves when people like get like they have animals, but then they like get animals and then that like puts the animals out that they had before. It's so you know what I mean? I'm sort of like, well, but you already had this one. I don't know. I just always think that's weird. So we made a
Yeah.
commitment to the guinea pigs. We're gonna see that through. And then but they are really angling for a cat. So eventually I'm sure it will happen. Like they love her. She's great. But you know,
Take the kittens because honestly, take one of the kittens, they'll grow up around guinea pigs and won't be as like
I don't
like the,
know. I don't know. I mean, I think some like I mean the prey drive is just it's part of who it's natural for them, you know.
it is. I think when you get it up early enough, when you get it early enough though, like you see so many animals that like normally would have a prey drive, but they grew up with them and kind of imprint on them
Can
a little more.
figure it out. Yeah, you might be right. That's true. And that's the thing is like we
Yeah.
could cover the guinea pig's cage too, like block it, but I just didn't trust that she wouldn't. I mean, I'll tell
Yeah.
you what happened. So she's right now where she is a chipmunk like so she's in right now like an outdoor like it's like similar to like a barn but it's like a nice area temperature controlled not here not with me but with somebody else
Yeah.
and a chipmunk got in it did not get out.
Oh, wow, okay. I mean, it's impressive, especially pregnant. Like you gotta imagine like trying
But
to.
she's had to survive. I mean that's a totally natural but I got sent to the after picture and I was like, oh, if that happened to one of the guinea pigs that would be a problem.
Oh no, that'd be
So
horrible. Yeah.
yeah,
So
I was like, it traumatized my children, so we're not gonna do that.
that's fair.
We have really digressed on this one. So anyway,
That's like we pivoted, but you know what? It was a quick pivot. But yes, focus on their food is always an important thing. For their vaccination schedules.
yeah. The other thing
You
is deworming too. So it's really really common for like parasites and stuff like that to be spread. And certain things like roundworms, I mean they can while they're pregnant, they can actually pass it through the placenta. Hookworms when they're nursing. So I mean again with planning, if you can plan it, it is better not to, have an animal that's infested with any sort of parasites, including ectoparasites. Like we really don't want
please
fleas,
and
ticks, And the thing that's good is that there is heartworm preventative and flea and tick preventative that's safe for pregnant animals. So I would just say before you put anything on your dog or cat or before you treat them for anything, just make sure that you consult with your veterinarian that you're using something that's safe because it exists so we can do it and we know that it's been looked at.
absolutely, yeah. Always check with your vet first. The more problems I see from people just being like, "Oh, I tried this medication." Like had another one this last week where someone's dog had a middle ear infection and they decided to put in a medication that should not be given when the ear is perforated.
Oh.
Not good for the dog. So just don't just ask. Always
Yeah.
ask.
Yeah, exactly. Um, and then as far as, what to do sort of like as things start to get closer. And I think this we talked about a little bit in our last one, but or maybe that's most of what we talked about was the fact that like, they can have problems giving birth. And if you've
Yeah.
taken on that responsibility, then it's really important to know what to expect, how to sort of detect when you think they're going to go into labor, like when they're close, making sure that they, have a comfortable, safe environment to have the baby in, but then also to keep an eye on them. And that's the other really important thing about going and checking, x-rays ahead of time so that you have an idea. And it's not perfect, right? Like sometimes, we do our best, but to have an idea of how many babies there are, because that way if they're struggling to give birth, if they're having a hard time, then you know to take them, to get help.
Particularly because for like two reasons. One, if you take, X-rays or radiographs ahead of time, if there's only two in there and a large dog, those puppies are gonna be pretty big probably,
Yeah.
and they have a higher chance of having an issue because
Mhm.
there's just more food for a smaller amount of dogs as opposed to like those litters that are 8 to 10. Those litters are usually the puppies themselves are just smaller because there's less nutrients to go around.
Mhm.
So that's like an important thing to plan for ahead of time. And certain breeds, as we talked about in the past, are more likely to have dystocias or can't actually give birth on their own. So you have to plan for like, hey, within this like 2 to 3 day window, where is the closest ER vet that can give
Mhm.
or like help my pet give birth via C-section, um, and talk to your vet ahead of time, see if they will be able to do it. Like, be like on call, like, hey, we're gonna plan for like a Wednesday, and that way you can have an appointment already scheduled. So that way, if you need to, you can do the C-section that day and avoid a lot of the complications because
Right.
that's a big expense and that was honestly part of the reason for this podcast is because I had a family that had their pug come in. It was their fourth pregnancy with it, and they know how many puppies were there. They couldn't afford the C-section, and we ended up losing one puppy in the canal. We lost another one overnight because they couldn't afford surgery, so they waited to their primary vet the next day. It needed transfusion because it started having bleeding uh, beforehand. So it got complicated because people weren't prepared. Um,
And now, I mean, the expense is like I used to tell people like, oh, have a couple $1,000s. I'm gonna say it's probably got to be 3 to 4 now.
yeah, it was like we're more expensive, obviously, but like
Yeah, you're in
we're
San Diego, but I'm just saying, like, because that used to be my thought was like, oh, about a couple $1,000s to, but now, I mean, everything's expensive. It's more expensive to do surgery, just to keep the doors open, to have overnight emergency and stuff like that. Like, I'd plan $3 to $4,000 for a dystocia. I don't know how much it is where you are. Probably more. 5?
they were gonna go to an urgent care that was gonna do it for 3,500, but
Mhm.
we're about twice that because we're just like board certified surgeons, stuff like that, and
Mhm.
whatever. But it's a lot. Either way, like $3,500 to 7,000. It's a lot, and you have to be prepared for it because. And honestly, maybe we'd go all the way back to the beginning of this. Is if you're, I don't know if insurance. I guess insurance does if insurance covered if you get
Would, right? I mean, catastrophic insurance should.
yeah
And if you have a dog that you know that you're going to be using for breeding and stuff, like, I can't imagine as long as they're healthy going into it, I would imagine. I mean, I don't know, right? Because I mean, I don't have anything to do with insurance, but I would think that it would.
yeah. I might check on that and see like one of the big insurance groups and see because I think it's important for owners to know because honestly, if you're going to plan on breeding your dog at all, get insurance. I don't know if once they're pregnant it'll count, but because
Well,
maybe
I
they're
think
like
maybe if you got the insurance when they were pregnant, probably not. But if you got the insurance and then they got pregnant, probably yes. And I bet you they have programs for pregnant animals. You know what I mean? Like it's a not a disease state, so I mean I'm sure that they have things for it. And that's the
yeah,
other part of like knowing what you're looking at. I mean, maybe if you know that that's something you want to do, then look into those things very like specifically. Um
absolutely.
and, like, I think some other things to think about too is, like, remembering that, when your dogs I again, cats, we don't generally have to do that much for them because they just seem to be amazing, and, I think maybe I could get educated by some purebred cat breeders for sure, that would feel differently, but for dogs, I know, especially because they just do go out and about into the world a bit more.
Mm.
You do wanna isolate them towards the end of their pregnancy. I think it's, usually, like, about that last 3 weeks, so, I don't know, like, what is that, the last, like, third of the pregnancy, just because we want to avoid them getting infectious disease,
Yeah,
while they're pregnant. Whenever you're pregnant, you tend to be more susceptible to, disease anyway, and people and you're sort of immune compromised in that way. Um, and so, and I don't mean to say that they're immune compromised, but I just mean to say, like, the same way human people are, right? You're just a little more prone to getting sick. Um, and
higher risk
so,
general consequences of getting sick are worse because it's not just you. It's the
right, right, exactly. And there are certain diseases that, unfortunately can cause the pregnancy to fail, so I think that, that's another thing to think about. And then as far as like, if you have a working dog or something like that, I mean, they can still exercise, that's okay, but go at their pace. You don't want to like push them or do too much, like anything that's going to stress them out. You want to try to keep stress to a minimum. And I think some of that stuff's a little bit common sense, but definitely the taking them out and about, and I think that that's somewhere around that 45 days, like, that last time that they go. and they get checked at the vet, like that's about when you want to start keeping them in, keeping them sort of in a place where, they're not around other dogs and stuff like that because we
Yeah.
really want to mitigate disease.
Absolutely, yeah, I think that's a big concern, and, I think I agree. Most time it's common sense, but it's good to say it because sometimes it's not,
Mm.
and wanna make sure, yeah, obviously, they're putting a lot of work and effort into their babies, wanna make sure they can have them safely and successfully.
Mhm. Right, right. And be careful with like you'll read things about like supplementing like calcium and stuff like that. You got to be really careful with that. Like
Yeah,
there's things that you can do under the guidance of a veterinarian that makes sense, but do not start just giving things based on what you read on the internet because they can have major metabolic concerns because of that. And so I would say really, really seriously, if you have a dog and if you've never taken or cat and you've never taken them to the vet before, don't be afraid to go and just make a new friend, go to the vet, get them looked at, get some advice on what to do, how to get them through. I have definitely had people come for their very first time ever bringing their dog to the vet or cat, that's like really they're not going regularly, but they want to do the right thing while they're, pregnant and will welcome you with open arms. Like I think any veterinarian really, really wants you to do the right thing and help you through it. So usually we also have handouts and stuff like that that we can give people so that like because it can be overwhelming too, just to get all the information all at once. So usually we'll give people a handout and make sure that they're getting good information to get them through that part and then, support them through it.
absolutely, I think that's the most important part, that's why we have these conversations, we want you to go see your vet ahead of time because it's like a planning's important, helps you avoid a lot of problems, some very expensive problems,
Mhm.
and just you wanna make sure they're happy and successful, that's the big things.
Yeah. And you can have lots of fun having lots of really cute kittens. And this again, I'm pretty excited. I think this little cat's going to have some really adorable little kitties. So we'll
You're
see
totally taking
when
one
she's
home.
done.
I'll put money on it that you'll end up keeping one.
I don't know. You got to talk to Paul.
Uh, have him tell that to 3 children that are like, "We want a kitten," and it's
Oh
like,
yeah. He's
like,
really really he's gonna he'd be the hardest one, not me necessarily, but he's never had a cat. So, I'm around cats every day. I love cats, but I think you take a dog person and you try to until he's been owned by a cat, it's a little hard to get him on
once
board.
you it's so funny, my dad was like that. He's like, "I don't like cats. I don't like cats." We got one cat. That cat was his best friend for,
Yeah.
like, 15 years afterwards. That cat would sleep with him every night, and he'd secretly, like, give it more treats. I'm like, "Alright, Bob. I see
Yeah,
your games."
you don't like cats, okay. Exactly.
They turned their best friends, so it's fun, and I'll have some more cats on our podcast probably sometime next week. So we'll see how some furry friends joining me probably in the future podcast. I can't wait. So
Ooh, I like that. I can't wait to see some friends walking by. But,
yep.
yeah, hopefully people got some good information from this. I always like talking about this. It's kind of a fun subject. I like puppies and kittens. I mean, hey, that's why we became veterinarians. So if you guys have any questions, you can always email us at podcast at my Balto? Oh my gosh, what is what's happening with me right now? Podcast at mybalto.com. And I don't know why I just had a brain skip there, but email us any questions that you might have. And we'd be happy to help. And always we like to, dedicate podcasts to things that people are interested in hearing. So don't hesitate to call us, to email us. Oh my goodness, I'm having a bit of a day. So anyway, this has been the Posit Podcast. Thank you everyone for listening.
Thank you, everyone.